as the G7 leaders meeting in France, WHO Director General Dr. Tedros Ghebreyesus and Brazilian President Lula da Silva are pitching for a pandemic treaty to prevent outbreaks like COVID. The stalled pandemic treaty is a high-stakes negotiation over macroeconomic risk management and intellectual property. As the deadly Ebola outbreak escalates in the Democratic Republic of Congo, the business case for a formalized biosecurity framework is urgent. Here's how the financial model breaks down. While containment of the current Ebola crisis requires immediate millions, maintaining global biosecurity requires an estimated additional $10 billion to $15 billion annually to fund surveillance and operational readiness for outbreaks beyond the World Health Organization's base budget. Funding could rely on a blended finance model. Public capital could come from rich nations like the G7. The cost of funding the WHO against future outbreaks is considered a hedge against supply chain collapses seen during COVID. But the bigger issue is around the IP tax dispute. The treaty's pathogen access annex requires multinational pharma companies to trade priority or prioritary products at costs in exchange for global virus data. The pharmaceutical industry is resisting the move, arguing that mandatory sharing weakens IP protections and could stifle private R&D and venture capital. With the funding, the WHO aims to pivot from reactive crisis management to a proactive global logistics manager. It plans to deploy funds across early detection networks, supply chain buffers, and decentralized production of tests, drugs, and vaccines. Global leaders face a stark trade-off: compromise private sector intellectual property incentives today or risk another multi-trillion-dollar macroeconomic shutdown like COVID.